All right, so welcome everyone. Today we'll be talking about clinical nutrition support for patients on GLP-1 and GIP or GIP, and we'll be talking about what is the dietitian's role in optimizing results. Honestly, I am very excited about this topic because we have been seeing a lot of patients, a lot of success, and initially we were not sure whether how we can support them, but now we know exactly what we can do to help them. So, what are the learning objectives? Today, we are going to understand a little bit about the physiology of natural GLP-1 and GIP-1 hormone, GIP hormone, I'm sorry, because it's very important to understand how these hormones work. And only then we can understand how we can help our patients and explain the mechanism of action of GLP-1 receptor agonist and dual GLP-1 and GIP. Also, recognizing common and serious side effects associated with GLP-1 therapy, recognizing the key benefits of these medications, explaining the role of the gut microbiome in natural GLP-1 production, provide patient-centered counseling and communication, and evaluate long-term consideration for discontinuation or maintenance. And also we'll be talking about how we can help these patients, because that is our primary goal, to help these patients and see how we can help them get best results when they are on those medications. A little bit about me. I'm Shivani, registered dietitian, registered and licensed dietitian, certified sleep therapist specializing in autoimmune disorders and inflammatory disorders. Also certified gut health nutritionist, practicing for over 20 years now. Actually, I started practicing in year 2000 and then got my RD certification here in 2006. So almost 26 years total, and use functional nutrition approach in terms of how we help our patients. I'm also the owner of Right Food Choice, Wow for Women program, and Metabolism Marathon. So also creating GLP-1 support program. So that is the number one thing that we are working on right now, GLP-1 support program. And today we'll be talking about how we can help these patients maximize their results when they are on GLP-1 or GIP or the combination of the drugs. So today we are going to understand a little bit about the physiology, a little bit understanding how the science work behind how the medications work, so we can understand how we can help these patients with the side effects or just to expedite their results when they're on these medications. So a little bit about, as everybody is a medical practitioner here, so but I'm still just going to go over it just for just to reiterate the fact that we have to understand how these work. GLP-1, again, as we know, GLP-1 and GIP-1 are the incretin hormones, and they are gut-derived peptides released in response to nutrient intake. Now, in this line, the most important thing is to understand that they are released in response to nutrient intake. That enhances the insulin secretion, and also together they link nutrient sensing in the gut to pancreatic, to central nervous system, and gastrointestinal responses, and we are going to talk more about it. So GLP-1 and GIP agonist medications are injectable or oral drugs that mimic these gut hormones. So what it means is these hormones are released naturally in our body, and these agonist medications, they're helping to boost the function of insulin. Also, let's just understand a little bit about the physiology. And as a good gut dietitian, registered dietitian, and certified gut health specialist, I would like to talk about how gut health is connected to GLP-1 and what's the physiology behind it. Where I am taking you from here is for you to help you understand how nutrition can be a key part of this whole therapy, and not just calorie in, calorie out, but it's way beyond that. And we have seen over and over again better results with patients. So what's the source and secretion of GLP-1? So these are the hormones naturally that are released by enteroendocrine L cells. specifically from the terminal ileum, which is at the end of the small intestine, and colon, the starting of the larger intestine. This is very important because this is what's going to help us understand what we are going to do nutrition therapy wise. So release in response to what? Usually it's released in response to protein, fat, and fiber and other macronutrients, and also fiber fermentation via short chain fatty acid, example butyrate, enhances the release of the GLP-1. Why? Because it's released mostly in the ileum and the colon. Circulation and metabolism, a little bit about this. It's rapidly degraded by the DPP4 hormone, DPP4, enzyme inhibitor. If you remember, I don't know if anybody remember, like there's another drug called Genovia that actually inhibits the action of DPP4 enzyme that in turn will help to boost GLP-1 to be there for a longer period of time. The only reason I'm sharing this little bit about the DPP4 because there are certain foods that can help with that function as well. Now, it acts locally and systematically through GLP-1 receptors. GIP-1, which is now getting more popularity, mostly they are used in combination, GLP-1 and GIP. So we have to understand GIP physiology as well for a second. GIP-1 is secreted from the enteroendocrine K cells, which are located in the duodenum and the jejunum. So the important thing to understand is GIP is released first before GLP-1 is released naturally. And it's released right after food intake. And also it is stimulated by dietary fat, carbohydrate mixed meals, and also rapidly degraded by the DPP-4. Now, it has a short half-life similar to GLP-1 and acts early in the postprandial period. So if somebody is, so we are going to talk more about it, how it helps to balance the postprandial blood sugars. This is like a little bit on the visual side. If you can see how our gut is, so you have stomach, then you have small intestine, large intestine. As you can see, the duodenum and jejunum is the site where you release the GIP hormone, and your large intestine, colon, and the ileum are the parts where GLP-1 hormone is released by the L cells. And as we are going forward, we will know why this is important to understand. So let's talk a little bit about the medications. Now, there are different types of medications right now in market, but I'm just going to talk about the most common one, semaglutide, liraglutide, and all these names. And then the brands. I'm just specifically going to go with the brands. So we know and heard that Ozempic is there, Wegovy is there, Rybelsus is there, which is used most commonly these days. Victoza was used before. Some of our patients were on Victoza before, but now mostly the medication that is more commonly used in the practices is tirzepatide, which is Manjaro for diabetes, and Zepbound for weight loss. And they target two incretin hormones, GLP-1 and GIP, offering even greater metabolic and weight loss benefit. So this is the most common one. I know where I have my practice, we see a lot of people on Ozempic, Wegovy, Manjaro, and Zepbound. Those are the four most common ones that we have patients for right now. These are the brand names. As we know, Ozempic is approved for type 2 diabetes. It's injectable, just GLP-1. Wegovy is for weight management, weekly injectable, again, GLP-1. Rybelsus is, I have not seen too many patients on that, but it's a type 2 medication, type 2 diabetes oral tablet that's given every day. It's not an injectable, but it is for GLP-1. And the Zepbound and Manjaro are the most recent ones. So Zepbound is used for weight management and Manjaro is used for type 2 diabetes. And they both are injectables and they both have GLP-1 and GIP hormone in them. So who is it for? As we know as clinician, it's for diabetes, obesity, overweight, BMI over 27 with comorbidity, or BMI over 30, metabolic syndrome, insulin resistance or prediabetes, also recently been approved for sleep apnea. Those who need help with also reducing appetite and cravings, improving post-meal blood sugar, and supporting long-term weight management. Now, they will talk about some complication, but what are the key benefits that we need to understand as clinicians, so how we can help our patients more? So people usually who are on these medication, the average weight loss that has been seen is 10 to 22% total body weight loss, depending upon the medication and the dosage that they are taking. Reduce appetite and cravings, improved cardiometabolic health, potential improvement in obesity related conditions, but the most important one is tool for long term behavior change. Now, why this is important for us as registered dietitians is because when we are looking to work on their behavior change long term and give them a platform where they are learning to eat healthy. Now, when they are on these medications and when they are not feeling like eating, their appetite is already less, it's much easier for us to step in and give them a path where they can make changes that they can stick to long term. Because there are other complications on the other end when they're eating less. And we are going to talk about that as well. But for the long term behavior change, this is a great place for registered dietitians to come in and help with all the complications they're going through, but at the same time, help them create new habits that they can continue with long term. So just for a second, I know we already talked about GLP-1 and GIP. I'm going to go into other things in a second. So I am just going to go over how GLP-1 actually work. So again, we talked about this. In pancreas, it stimulates glucose dependent insulin secretion. It also suppresses glucagon release. We all know that it's going to help us not have our liver release more glucose in the system. That's going to be helpful. In the GI tract, it delays gastric empty time and reduces intestinal motility. Now, these 2 points are very, very, very important because this is going to help us identify how we can help them in their GI issues. Also, in the central nervous system, the brain signal, they bind to the receptor in the brain that controls hunger and fullness, reducing appetite and cravings. And in the peripheral effects would be improves postprandial blood sugar and modulate cardiometabolic pathways. On the other hand, how GIP-1 support this whole system is your body uses glucose more efficiently. It functions as an early incretin signal, priming insulin response, and also enhances the body's response to insulin, meaning lower blood sugar without needing more insulin output. Also, again, it reduces appetite through central nervous system. GIP also has a satiety effect different from the GLP-1. Now, one more thing with the GIP is that it influences lipid uptake and adipose tissue metabolism and adipose tissue signaling. And that's why you see greater weight loss when people are on both GLP and GIP and better energy utilization. Now, let's talk a little bit about when they are using both. So they again have stronger appetite suppression, greater metabolic effect, and higher, also a negative could be that higher likelihood of GI side effects that I have seen in many of the patients. Why? Because now they're getting feeling of fullness from both sides, and we're going to talk a little bit more about how it affects how we counsel patients when it comes to people being on Manjaro and Zepbound. So for that, what we need to understand first, what is the normal physiological levels or natural levels of the GLP-1 and the GIP hormone that are released by our body or our gut. So when it comes to natural level, think about you and me who is not on any medication. The fasting GLP-1 is usually about 5 to 10 picomole per liter. And after the meal is usually 10 to 15 picomole per liter and sometimes up to 20. But usually it stays in the range of between 5 to 20. And for the GIP hormone, again, it's 5 to 10. And after a meal, it can rise to about 20 to 30 picomole per liter or higher, depending upon the meal. It was a carb heavy meal, fat heavy meal. All those factors will affect how much the GIP-1 is released. And these amounts are very small and tightly regulated, rising only briefly after eating and degrading quickly. And that's where the DPP-4 enzyme also come in between and say, hi, I'm here, I'm gonna not let you be there for a very long time. And it breaks down the GLP-1 and the GIP that is naturally released by our gut, so that we don't have that bloated feeling of fullness all the time that we get when we are on these medications. Now let's see what happens. Somebody is on Ozempic, Wegovy, or other medications. They create much higher and long-lasting GLP-1 receptor activity. So as we just mentioned, it only stays there for some time. But the amount that is released in injectables, it's about 5 to 10 times higher than the natural post-meal GLP-1 levels. So, and it stays active for days, an entire week, as we know that it is an injectable that works for the whole week and not minutes, just for the whole week. And why? Because molecule that has been created is modified to resist the DPP-4 breakdown. So GLP-1 stays longer in the system, binds strongly to the GLP-1 receptor, stays in circulation for longer, and your body could never naturally produce this level or duration naturally. And that's the big difference. Imagine from 5 to 10 to about 100 level of like 10 times more having GLP-1 circulating in your gut. And that's what gives you the signal that you're full. Again, if you see again, if in this image, again, if your, your duodenum and your ileum, your colon, they are releasing GLP-1, GIP hormones 10 times to the required one, that's why you don't feel hungry, because they are usually released in response to food. So even now, even if you're not eating, you have GLP-1 that's making you feel that you're full. So the key difference between natural versus medication: natural meaning release only when you eat, and medication is always on. This is a very important thing to understand when it comes to nutrition counseling for our patients, so that we can understand the physiology of what's going on in their gut. They break down in 1 or 2 minutes because the enzyme DPP-4 destroys them quickly, but in this case, it stays higher, 10 times more. Natural hormones are short acting, but medications are not short acting. They stay active for days. Natural hormone, the body controls them tightly to avoid excessive appetite suppression or hypoglycemia. But in this case, GLP-1 is just bound to the receptor and it's there all the time. And that's why nutrition and gut support are so important. Because in natural hormone secretion, GLP-1, GIP, you're not having any side effects. But with this medication is 10 times more, you may experience some side effects. If you see in the image, once the GLP-1 hormone is injected, it's going to be stay bound to the receptor, unlike in a natural way where it's time bound and it's broken down after some time you have eaten. But the other one, which is the medication, is going to be attached to the receptor like for a longer period of time. All right. So what happens? So when you stop the medication, most people regain some or all weight. Appetite usually returns quickly. Blood sugar can rise. And also, the most important one is metabolic adaptation. Because when they are on these hormone, the GLP-1, GIP hormone, they are eating very less because now they're not feeling hungry. They're not eating the way they used to eat. And sometimes the calorific value is actually way lower than their body's basal metabolic needs are. And that's when they go into metabolic adaptation. Now their body don't know how to burn excess calories because they're not even meeting the minimum requirements. So that's also something we have to come into nutrition practice when we talk about lifestyle change and nutrition. So some of the common side effects that we see are nausea, vomiting, diarrhea, constipation, bloating, feeling of fullness. Some people have burping, decreased appetite, fatigue, headaches, These occur because of the slower gastric emptying time that we talked about. And some of the studies have actually shown, I have posted one study over here, that um, also there is a lot of what they have seen is muscle loss or the lean body mass loss as they're losing weight. They're still doing more studies on that, but with studies showing up to 39% of lost weight can be muscle, which is higher in terms of, because if, see, think about it, muscle is there to help you burn more body fat. If you're losing muscle long term, it's not going to be helpful to you. So that's where the counseling, and we're going to talk about what we actually do to help these patients. But just understanding these points first, I think it makes more sense when we think about how we can help the patient. Some other risks could be gastroparesis, and then pancreatitis, gallbladder issue, gallstones, kidney strain, or dehydration. Some of diabetic retinopathy. These are all severe side effects. Mood changes, monitor for depression and suicidal thoughts, especially with Saxenda and Wegovy. That's what the research says. This is backed up by clinical trials and FDA warning. So that's why I'm just putting it over there just for awareness. Thyroid C cell tumors, also aspiration risk during anesthesia due to delayed gastric emptying time. Let's talk about some practical ones, which we see in our patients a lot. So, anytime you're having a rapid weight loss like that, regardless of you being on a medication or not, what's one thing that's going to happen? Fat breakdown, right? So, gallstones are very common, and rapid weight loss releases excess cholesterol into the bile. And when fat cells shrink quickly, they release large amount of stored cholesterol into the circulation, and the liver responds by dumping more cholesterol into the bile. And when bile becomes supersaturated with cholesterol, it can crystallize and form stones. So it's very important that we address that when we are talking to our patients. And there are a lot of strategies we can use to make sure the gallbladder function is going fine, and normal gallbladder contractions are triggered by dietary fats. If they're not eating healthy fat in their diet because they're not hungry, or they're just not eating because they don't feel like, it's not going to be helpful long term. So something also to make sure we talk about. So anytime your weight loss is exceeding 1.5 to 2, like 2 pounds a week, that's most common side effect that people develop gallstones. Another one, very important one that I have seen is endotoxemia or toxic overload, we can say. Basically, endotoxemia is a term refers to the presence of endotoxins, primarily from the LPS or the lipopolysaccharide from gram-negative bacteria, and it can enter the bloodstream and cause systemic inflammation. And during rapid weight loss, this risk increases due to gut fat liver axis overload, because now you're producing. So usually people who have more adipose, more fat cells, most of the toxins are trapped in the fat cells. Now when you're losing weight so quickly and your fat cells are shrinking, guess where all the toxins are going? You are releasing those toxins in your body, but if your liver, which is the main organ to filter, is not functioning fine, your gut is not functioning fine, that's when all these toxins can cause more problem and put more inflammatory burden on you, or something simple as having brain fog, tiredness, and all of those things can happen more. Many people try to overcome that and not talk about it because they think it's okay, it's just a side effect of like the medication and all that. But it's very important to address that, because there are strategies we can use to make sure their liver detoxification is going smoothly. So, when fat is lost quickly, these toxins are released into the bloodstream faster than the liver and gut can eliminate them. So basically, this is, I'm sure everybody knows this, the detoxification pathway, the phase 1 and phase 2. So there are some key nutrients that are involved in the phase 1 and phase 2 cytochrome P450 enzymes that we need to make sure we are eliminating the waste. So gallbladder should be functioning fine, kidneys should be functioning fine, bile should be functioning fine, urine, your kidney function should be fine. And also, if you are not pooping well, which is a very common side effect, because if you're not pooping well, you are not eliminating toxins either. So we have to make sure their gut system is working fine. And also, we all know that detoxification is not drinking lemon water or green juice. There's a proper pathway or the supplements or the nutrition that we need to address so that the proper detoxification can work. And also, why GLP-1 users may notice this more than somebody who is not on medication, just because they're not eating enough. Their food intake has gone down, less fiber, reduced gut motility, very, very, very important, bacterial overgrowth, because now because of the sluggish motility, the movement of the food is slow. The food is sitting down in a smaller intestine for a longer period of time, where it's giving rise to more small intestinal bacterial overgrowth if there is a bacterial disbalance, and if it's feeding on the food that has been sitting there for a longer period of time. So very, very important to know that we have to work on the detoxification as well as they are on the medications. Now, I have two case studies here that I put together just so that I can show you a comparison here. So there are two patients I had many, just I picked like some that could go hand in hand, and I could show you the comparison. And this is not to show you whether medications are bad or good, or I'm just showing you how results can vary, why there is a lot of muscle loss that I see in my office, in my clinic. So this is a 25-year-old woman, not on GLP-1. She started March 2025, and December 2025 was the last visit. If you see her weight loss, she went from 202 to 163 pounds in those months. But if you look at the reduction of the body fat, and this is with the diet alone, the detox, the diet, and all of other things that we do, body fat percentage went down to from 50 to 40, which is not very significant, but still lower. 10% is a lot of body fat loss. And visceral fat went down from 7 to 6. But the most important thing, if you see over here, the muscle mass went from 21.3 to 26, because we've made like a lot of lifestyle change and exercise and all of those things and diet, from 21 to 26 versus somebody here. This is these measurements we do actually in the office. So this patient, 30-year-old male, on GLP-1 from July 2025 to November 2025. So he just started on GLP-1. Actually, he really needed that, I think, because he was not losing weight because of his traveling and all of those things, and it really helped him. So he went from 221 from 205 in these months. But look at this. The body fat percentage went from 36.5 to just 35.1, which is only 1% body fat loss. And visceral fat, which is more dangerous kind of fat, it should be 9 or less. He started at 17, and it just only went down to 16. But look at the muscle loss. He went from 34% to 31. He actually went down. And he's not following all the regimens that we have been recommending and all that. But you can see how there could be muscle loss when people are on these medications, unless and until we measure that, we don't know whether they're losing muscle or losing fat. So of course, he looks leaner, but in long term, I don't think it's a good idea if he keeps losing muscle. Another case study. So this is before the all these medications came. So this is 2023, when we were not using, when nobody was using at the time, not too many people, not that nobody was using. So he actually, I mean, he was a retired army personnel. He went from, unfortunately, I don't have the whole data on it because he had a lot of virtual calls because he was far, but he went from 456 pounds to 275 pounds, lost about 181 pounds in about 1.5 years. And all he did, just stick to the diet, and he could not actually move a whole lot uh, because of his heavy weight. So he could only do like water aerobics and things like that, so whatever he could do at that time. But as he was losing weight, he was walking. But this was without the GLP-1 medications. So just to show that, yes, people can lose weight, but some people really need help too, as the previous guy one. But we just have to make sure that we are not losing muscle. So not so the most important thing here is not how much they can lose, rather how long they can keep it off, and also making sure that losing body fat percentage is more important than losing muscle. So that's where the role of registered dietitians come. And now I'm going to take you through the journey, how we can help and what we can do to help our patients. Now, the number one thing starts with comprehensive assessment, and it starts in the beginning, even before they are put on the medication. Why? Because the number one thing we need to do is do a nutrition assessment and individualized planning by understanding where they are right now. So, evaluating the patient current dietary intake, eating patterns, nutrition gaps, in-depth assessment of their macro and the micronutrients, what supplements they are taking, what medications they are taking, what are their recent labs, do they have any comorbidities, what is their medical history, their measurements, everything. So we need to do a very thorough assessment even before they go on medication. And another thing, people are all excited about going on these medication. Now finally they're going to lose weight. What are they going to do? They're going to start eating their largest meals and their favorite foods right before, a week before. Now, if they already have a sluggish gut health, if they have less motility, if their bowels are not moving, they're not doing any justice to themselves because they're going to be even more bloated once that injectable starts to work, because they were already bloated to begin with. They just want to make sure that they finish like the largest meal before they even get into the program of the medication. So very, very, very important to have the right assessment even before they start. So second one, monitoring, educating them, and ongoing nutrition support. Now, guiding patients toward nutrition dense meals, high quality foods to meet their needs, their hydration, their physical activity, their lifestyle education, how is their stress and sleep management, providing them ongoing education and adjustment as medication doses are adjusted or titrated. So if they're seeing a physician every month, or however they decide to titrate the medication, we have to make sure we are at least giving them seeing them twice a month, just to make sure they're not having any side effects. Not only side effects, how they can meet their calorific needs, so they don't get into metabolic adaptation later on, where they just not able to lose, and they just stuck, and they lose all the muscle mass, and also that once they stop it, they're going to gain all the weight back. So we don't want that. Also, as a role of as a registered dietitian, our responsibility is to have interdisciplinary collaboration and symptom management, both with the physicians and the patients. So, collaborate with prescribing providers and other healthcare professionals, including psychologists, exercise specialists, GI doctors, even if you see any complication with the GI, effect, I think it's a very good idea to encourage them to see a gastroenterologist, just to make sure everything is fine if there is a need to, and other specialties. So that is dietitian's responsibility, that we need to make sure that we follow our guidelines. But what are the guidelines for our patients? What do we do for the patients? What are our goals for the patients? So I have just divided it into different 10 points, just to make sure we can make sure we touch each area very seriously. We take everything to the T, and make sure we are providing and educating the patient in the way that he gets the maximum effect. So the number one thing would be optimizing nutrition intake despite reduced appetite. I don't know. I have so many patients who have been, oh, I don't feel like eating. Oh, I don't feel like eating. Yes, you don't feel like eating now, but what's happening to your micronutrient deficiencies? What about all the B vitamins? What about anything, vitamin D, vitamin B, iron, vitamin C, all those micronutrients that are actually needed for your overall health? Think about it as like somebody going on a bariatric surgery. Remember when, I remember when I was in Texas, I had this bariatric doctor who was sending patients, and all we had to evaluate the micronutrient deficiencies because depending upon the surgery that they had, we had to make sure they are taking supplements. So they're absorbed because their meals were really, really calculated, really, really small. So they were not getting the micronutrients, minerals, and vitamins, and all of those things. How can we emphasize the nutrient dense meals, the high quality foods to meet calorie needs? Again, we have to remember that yes, patient feel like he doesn't want to eat, but we have to make sure that he's not eating 500 calories a day, because if he is doing that, that's where the metabolic adaptation goes into play, where they won't be able to lose any more weight later on, no matter what they do, because now their body is adjusted, or they will regain the weight back once they start eating normally, because once they are off of the medication, they are going to be hungry again, and they're going to be start eating. So can we make the meals smaller and make them calorie dense? That will be really helpful to the patient. Preserving their lean body mass and metabolic rate. Again, talking to them about protein intake and resistant supportive nutrition, and also talking to them about not having muscle loss and making sure that they're doing some strengthening activities and things like that. Managing their gastrointestinal side effects. So again, as we mentioned before, because of slower gastric emptying time, they may feel nausea, reflux, diarrhea, constipation, bloating, food intolerance. How can we help them get rid of these symptoms, have the maximum effects of the medication without having to go through all these things? So we need to adjust their meal size. We have to adjust the frequency of their meals. We have to talk about the fiber, and not just fiber, actually, what type of fiber is needed at that time, depending upon their symptoms. We all know there are different kinds of fiber. Hydration and fat intake. So all of these things are very important in managing their GI symptoms. Maintaining blood glucose stability, so preventing hypoglycemia. Now, if you're skipping meal inadequately for a longer period of time, I have had patients, actually patients on the Stello, the Dexcom. So I actually monitor their blood sugars and everything, and you can see the blood sugar dip to 50 at night, and no wonder in the morning they're groggy and upset, and they can't wake up in the morning fresh. So this is very important to maintain their blood glucose despite of them not eating well. So we have to train them in terms of micronutrients, balanced meals, consistent eating patterns, so their blood sugar stays stable. And how can we support gut health and the bowel function? So this is different than the GI side effects. Now we have to make sure we are helping them with their detoxification pathways. How is their microbiome? Do they need any probiotics? How is their motility, which means that how the bowels are moving? Are they sluggish? Just to make sure we can help them with the reduced risk of constipation, so they're able to move smoothly. Promote normal and healthy eating behavior, so preventing overly restrictive eating and fear-based eating. Now this is very common. Like now somebody is coming in for weight loss, and they're all excited about the medications. Now every time they eat, they feel bloated, they have nausea and things like that, because they're thinking it's medications, not thinking because it is the side effect of the medication that they may be experiencing. But can we help them with the mindful eating techniques? Can we help them with the reinforced regular meals and flexibility? Can we help them reduce the risk of weight regain beyond medication? So as the dosage changes, or they discontinue, or whatever, for whatever reason they stop taking medication, have we provided them with enough education so they don't gain the weight back? Supporting hydration and electrolyte balance, very, very, very important, because now First of all, a lot of people feel very bloated when they start drinking water, especially if they're drinking with the straw, or they have less thirst cues. They don't feel like drinking. So we have to make sure, are they having any headaches, or they're having any crampings? Do they have any dizziness, or again the constipation? So we have to make sure their hydration and electrolyte balance is there. Now, usually once they're on medication, once they start, they slowly get adjusted to the medication, and that's what we have to do, slowly readjust them with the new way of eating. And that's the perfect scenario where we can help them, educate them, and change their life, diet and lifestyle. Address the relationship with food, creating long lasting dietary habits, normalizing appetite changes, food aversion, support healthy and non punitive approach to eating. So, all or nothing mentality doesn't work long term. So, I am not a kind of a person who is telling them you can never eat a dessert, or no, you can never eat a birthday cake. I don't do. I eat my birthday cake as well. But we have to make sure that they know that it's a lifestyle change. It's not like, oh my gosh, I'm just going to take this pill and it's magic. But we have to create long-term habits, providing ongoing education and safety monitoring, and setting realistic expectation for weight loss and side effects. Identifying the red flags and coordinate care with prescribing provider is very, very, very important. We often fax our notes to the doctors, or often like let them know about their progress, so that way they also know what's going on, what's the progress about the patient, if there are any side effects and things like that. And how do we do that? So for me, we are meet our dietitians. I am I'm not here in the picture, but I'm Shivani, registered dietitian, owner of Right Food Choice. But we have three amazing dietitians on board. We have Diksha, who is not only a registered dietitian but also a lifestyle DPP coach. She's amazing at behavior modification, with or without GLP-1, doesn't matter. She knows how to change people's behaviors to get results. We have Alicia, who is actually a registered dietitian and a personal trainer. So we have some patients who get one-on-one consult on the what kind of exercise they should be doing, and she does all virtual calls. So we have a system where we can provide strength training exercises if they're on medication or not on medication, but she can also guide them with nutrition and exercise at the same time. And we have Julie, our meditation and mindfulness coach, that can that can help people with meditation techniques, mindfulness techniques. We actually had a full last year, we were doing every Monday meditation calls, and they were amazing because it helps you to calm down, helps your vagus nerve activation, and a lot of other things. Anyway, she's amazing at what she does. So she's also a registered dietitian and a mindfulness coach for the programs that we have in our practice. But how do we do that? So we do offer face-to-face appointments, personalized in-depth nutrition assessments. As you saw, we do body fat percentage, muscle mass, visceral fat, and all of those things. And it also helps them with strong relationship building and accountability. We do provide telehealth. So if somebody is traveling, working from, don't want to get out of the house in the snow that we had today, so we can still, they don't have to miss their appointment, or the follow-ups or the check-ins. We can do it via telehealth. We do have a group coaching program. So we do monthly and bi-weekly coaching calls, where we are in a supported environment where a lot of people, like-minded people, are there. So one of our dietitians, is me, or the other three will be conducting the class and helping them if they have any Q&A, or we pick a topic or talk about that. The most importantly, we provide meal plans and recipes. So we have GLP-1 friendly meal plans focused on macronutrients, micronutrients, and gut health. Also, easy to follow recipes to design to reduce your symptoms, and printable materials. And we also have actually app where they can actually go through the recipes, and we can also individualize it for them as well, depending upon their lifestyle, their preferences, how much they like to cook or they don't like to cook. We can help them with that. We do have some extra handout and educational material that we provide to patient or share with patient as needed. like grocery shopping list, a visual infographic on the GLP-1, GIP. I cannot tell you enough how much people appreciate when they understand how things work in their body, and they tend to follow more. I don't care whether they have a science background or not. I just love to explain it to people how something is functioning in their body and this is what they should do, and they follow it even more. That is something I would recommend to everybody. And any FAQs and also recorded modules, learning modules we have so much educational material that is recorded already that they can listen to. We have meditation videos, exercise videos, gut health videos, lot of things that are available for them that suppose their long-term retention. And we do have practical, meal planning tips. We teach them balanced plate method, so that way they can understand long-term how they have to eat, um, depending upon what their needs are. We talk about protein, small meal, snack, grocery shopping, dining out guides. We also have journal and tracking tools for accountability. So I'm going to show you in a second what we do, but they can track their food, their symptom, their hunger, their GI symptoms, and guides to help to adjust their whole routine depending upon their symptoms. Also, we provide behavior and lifestyle support with mindfulness classes, meditation classes. We talk about stress and sleep hygiene a lot. We talk about movement, physical activity, strength training. We have recorded session or live with Alicia that they can do. Um, Habit building for long-term success. And also we use HIPAA compliant accountability and progress monitoring via tech. That's what we do. So they have constant chat messaging system with that is HIPAA compliant. So if they have any question, they can ask us anytime and we can answer as soon as we get to that. We use a very non-judgmental support, non-judgmental approach to support our patients. So it's not that, honestly, I am not 100% healthy all the time. So I don't expect anybody to be that way. With Indian people, we have so many festivals that we end up eating a lot of foods that we should not be eating unless if you are not paying attention. So we expect 80-20 rule. So 80% of the time, can you follow something? 20%, yes, it's okay. That's a lifestyle change. Of course, we are looking for habit change and not perfection. Other than that, as a bonus, because I specialize in gut health, I do talk about functional food approach, eating habits to boost natural GLP-1. Although you can never increase your GLP-1 to the level what medication provides, but we can definitely use some certain herbs and spices and certain things to enhance the GLP-1 function, to enhance the insulin function, certain dietary habits, how we make our meals, and so we definitely include those strategies in the meal planning. I consciously do that all the time because I know that's internally it's helping them. You can go online and say, hey, curcumin or turmeric help you reduce inflammation. Are you taking the golden milk? But is it golden milk the only thing that you need to boost your GLP-1? Do you know whether it helps in that or not? Or you're just getting something off of the internet and say, hey, these foods are good for you, just take it. And there are so many places where somebody should not be taking turmeric. So that's where this comes in, like supplementation and functional food. Also, we have a full 4-hour detox program that we give to our patient. They do it on their own and they love it. Just many people, they just stay on that program. It's only 10-day program, but they stay on that like long term because they feel good. They have good results with that. Just a sneak peek to the material that we have. Building a GLP-1 kitchen, managing the side effects of GLP-1 medication, how to build a plate, how to have like healthy recipes. What do you do if you have nausea? What do you do if you have constipation? How about, what kind of electrolytes that you can make at home or you have to purchase, or what can you do actually? So these are practical handouts that we provide to patients. And we do have the app, so we always upload everything in the app as well, so they have access to it anytime. Also, tracking and journaling, this is how it looks like. I just picked out some of the pictures from some of my patients. So they just take pictures of their food and post it. You literally don't have to do, like, even write it down if you don't want to. Just take pictures before you start your meal and post it. Just write about your bowel movements. Was it satisfying? Was it, I have like great detail of the bowel movement because I work a lot of gut health patients. So people actually describe how their bowel movements are, but their water intake, the snacking, and even if they eat a dessert like this one, coffee, ice cream. So they don't shy away from posting. We encourage them to post the real things so we can help in real time. Like, what, okay, you had this, so when did you have this, how much, what was the portion size, what could be done better, so that it doesn't spike up your blood sugar after meals. So something like that. How can we help? Well, our team of dietitians can help in many ways. For your patients to get best results, we provide resources and materials. We do have membership, monthly membership, where they could attend the classes and get access to a few things. And also we provide one-on-one consult to our patients. Or if you need all of the above, we provide all of the above as well. How to connect with us? So if you are a registered dietitian or a clinician, you have my phone number. There you can reach me. How we can either help you help your patients, or help you if you have any patients yourself. We are in Troy, Michigan. Yeah, there is an email address, Shivani at Right Food Choice, and the website. So in case if you have any questions, any concerns, or if you would like for us to work with your patients, we would love to work with you, and help improve patients' longevity, one patient at a time. So with that, I am done. I hope you enjoyed the presentation, and if you have any questions, let me know.